Hey guys, it's Dr. Skillen again, coming at you to talk to you about a few more new services that we'll be offering here in the Pain Seek Clinic. Those two services are, one, the monoclonal antibody therapy. We've got that in the clinic right now where we can give it to you if you fit the profile that it's going to be efficacious to give it to you for, okay? Now, that profile is this. Your symptoms have to start and you have to have a positive test within a 10-day period. Not 11 days, not 12 days, but all that has to happen in a 10-day period. You get sick enough to feel that you need to go in and talk to a provider. You go in and hopefully they've either got the PCR test or better yet, the rapid antigen test available where they can test you. Once your primary care, whoever you go to test you, if they come up with a positive result and you're still within that 10-day window, then you can go to a lot of places to include Pain C to get this particular therapy. There's a couple of ways you can get it. One way is through an IV line. We start a line in your arm and we can give it to you. The longest it'll take is if we use a 250 milliliter bag. It'll take about 45, 50 minutes to get all of that in you with the full dose of the Revcon monoclonal antibody therapy that we currently have on board. So that's the brand that we're using. They all basically work with the same mechanism, so I wouldn't get caught up on different brands or whatnot. But with that, again, that 10-day window, you can reach out to us or reach out to a facility that's close to where you live. And a lot of times I'll go ahead and schedule you. And we sometimes, if you come to me and you are still within that 10-day cycle, but if you're on 8, 9, or 10, if you can't come in to do the infusion, then the other option would be to do the injections. We can give you the same solution through subcutaneous injections, which it's a total of 10 milliliters that we put in a bag, or 10 milliliters that we draw up in 4 separate syringes, okay? We put a sub-Q needle on that, and we can give you shots in your triceps muscles, each side, and 2 shots in your thighs, in the fatty tissue. That's what the subcutaneous injections are for, or do, or where they're placed, okay? So we can do that. After you have that done, then we still have to watch you for an hour. After the IV is run in, 45 minutes, 30, 45 minutes, we still have to watch you to make sure you don't have reactions for it for an hour minimum, period, okay? We don't deviate from that. Not gonna let you go in 30 minutes if you feel okay. Not gonna let you go in 40 minutes if you feel okay. We need to watch you for an hour. And we're gonna communicate about that before we initiate the process. Because if you leave here before an hour and you have a reaction, nobody out there is gonna know what we gave you unless you have somebody with you. If you stay here for at least that hour, it's been examined in the data and everything the FDA and the CDC looked at, that a good hour afterwards, if you're doing okay, you're probably not gonna have any issues. But it's that 1 hour after the infusion. So the time that we give it, we're about to pull the IV line out. We still gotta flush that line to get the total dosage in your system. The time starts after we've done that, okay? 1 hour, okay? Now that you have an idea of the time frame and what we'll be doing during that time frame, let me try to explain to you how this therapy is supposed to work, okay? When I say that, the big wigs at the FDA, the big wigs at the CDC, these people know how to read the studies. They know how to look at the trends. These are the people you want looking at this data. They've looked at all the data that's been compiled, and they've made this decision based on that data, that monoclonal antibody therapy is efficacious within that 10-day window. Get infected, or you start feeling sick, ill enough to go in, you come into whatever facility, mine or Quick Stop facility or any place like that. If they test you, It doesn't matter if it's the PCR test, which takes 2 to 4 days to get the results, or the rapid antigen test that can take 10, 15, 20 minutes to get the results back. You need that within that 10-day window too. If you have those two things and you get to me on that 9th day, we're going to make something happen on that 9th day. Because on that 10th day, I can't give it to you. Or thereafter, I can't give it to you. So we'll work that out, but I want you to be aware of the time frames that we're working with to give you that particular therapy, okay? Now, I'm not going to get too technical, but I found a good slide on the internet that I hope will explain to you what the monoclonal therapy is supposed to be doing. And the FDA and CDC agree. So for me, that's enough. I follow the science. But let's look at this diagram. If you look at the bottom piece there, that is a healthy, normal cell in your body. And if you look at how it's structured, it has those spikes sticking up. If you look at the spikes on the furthest end or distal end, you have what looks like an opening or a key or a lock set, just like that, okay? That's on the end of those spikes of the healthy cells. Now let's look at the COVID-19 virus itself and look at how its spikes that are sticking out look. If you look, they have this formation. There's a reason for that. That's how they actually get into the cell. That key that the coronavirus, COVID-19 virus has to fit within the lock mechanism of your healthy cells to allow it passage within the cell to infect it. That's the process that happens when people get infected. That's the simplest way to explain it. Okay, you got the virus floating around. The key is put in a lock. The virus is allowed passage into the cell. It infects it, and then you start having all the bad symptomology. At worst case scenario, you need to be put on a respirator and that sort of thing. That's what's causing it. Your good cells are infected by this coronavirus, and it's a virus. We don't have antibiotics for a virus. They don't treat viruses, okay? We have antiviral medications. Some of them they give while you're in the hospital, and that's basically that, and stop the inflammatory process that we see with people that are infected who are having a bad course with the disease process, okay? We're getting back to the slide. I don't want to drift. Now look at the X's that are floating around. Those are your body's antibodies. The monoclonal antibody therapy, it stimulates your body to make antibodies, and it has a piece of the coronavirus to it, inactive, dead, it's not going to infect you, piece. And it has that piece to show your body what to look out for. It's saying, hey guys, this bad guy's in the area, look out for him. He may show up. So your body produces these antibodies, which are those X's. And if you look at this diagram, what are those X's doing? Their action is to block that mechanism of the cell being invaded. If they plug off the key hole, which is the access way that the COVID-19 virus uses to get into the cell, if they block that off, that cell can't be infected. And if you look at some of them, they've identified the COVID-19 virus as a bad guy, okay? They've already started attacking it. And what they do with those is they block off the ends of the COVID-19 virus. So on that side and this side, you have blockage. And once the key can't fit into the lock, the cell can't be invaded. Thus, the COVID-19 virus is neutralized, basically. Why? Because the antiviruses, as you see, they're going to keep going at it until it can't do anything. And then your body's normal waste distribution cycle gets it out of your system. So it can't infect you, basically. That's what the monoclonal antibody therapy does. It creates or stimulates your body to create antibodies that take the mechanism of action of blocking that access way. And again, once that access way is blocked, no new cells can be infected. Now, what that will do with the coronavirus infection you may have is stop your symptoms from getting worse. Why? Because it stops any further infection by the viral or the COVID-19 virus. Why? Because it's blocked off everything. Your body will then go through its normal cycle to protect itself. Your body can protect itself against viruses that it sees, can't always neutralize them. I'm going to throw in the herpes virus. It parks somewhere in your spine or in or around your spine, and your body can't kill it all. That's why there's a repeat of those symptoms of the herpes virus, okay? Now, with the coronavirus, it doesn't work with that mechanism. If it can infect and it's blocked off, that's flushed right out of your system. And you should start improving as you go along. Now, if you get the monoclonal antibody therapy, it's not going to be night and day, folks. You're not going to be up tomorrow ready to go run 10 miles, but you will be better off than if you had not had the therapy as far as any further infection of your cells. And if you think about what I just said, however sick you are at the time you get this therapy, and to get this therapy, if you're too sick, and what I mean by too sick is someone should check your oxygenation, your exchange of gases, before they consider giving you this therapy. If your gas exchange or O2 saturation is in the low 90s or below 90, that's not a monoclonal antibody therapy person. That's a person that needs to go to the hospital. There's something preventing that gas exchange. And if you're positive for COVID, it's probably the COVID-19 virus. And you may have pneumonia, okay? Secondary to the COVID-19 virus, or bronchitis, the coughing, this, that, and the other. If they do some type of lavage, sometimes they can identify any bacteria in there, but there is no antibacterial that's going to work against the virus itself. That's not how they work. We do have antiviral medications that have shown to decrease the symptomology, as well as they use some steroids to decrease the inflammatory process that the coronavirus causes in most systems. We've seen it consistently. So they treat them with that. It's basically to hold off the virus from infecting anything else while your body attempts to recover. You follow? Now, if your O2 sats are fine, that's up in the high 90s or preferably 100, but you're sick and you want to get the therapy, then you can have the therapy. If there isn't any other signs that would warrant a provider telling you, I don't think this is going to be what you need. Why? Because you're too sick at this point. You need to go to a hospital. Once you get there, they're going to do a full evaluation, which is going to include the chest x-rays. Okay, if you're coughing and I see you coughing up stuff and you got low O2 sats, I don't have a way to look at your lungs to tell if you've got pneumonia or not. So I would tell you to go to the hospital. It's free, guys. You don't have to worry about that. The government's covering it as well as the state. So, but that is the monoclonal antibody therapy. If you have any further questions, this is my email. I'll answer all your questions, even if you're not coming to me. If you have a question, just shoot me an email. I'll look. If I don't have the knowledge on board, I'll look it up. Simple as that. Okay. The other service that we're offering here in the Pain Seat Clinic is going to be the Pfizer injection for 5 to 11-year-olds. Okay. The 5 to 11-year-olds are the last ones to be recommended. Why? Because we needed more data to support it. We always need enough data to support the fact that it's more efficacious to use this with 5 to 11-year-olds than the risk. You follow what I'm saying? If the data we had didn't show that the vaccines were efficacious in that age group, we couldn't do it. We couldn't support doing it. And the big wigs at the FDA and CDC have looked at that. So, and if you've been following the news, you'll see they meet, they talk, they look at the data. These are the people that do the papers, write the studies, know how to follow the studies, look at the trends. All of this stuff is taken into consideration before making such a recommendation. And I'm going to add something here. I got 2 granddaughters that are 9 years old. When their mothers call me and ask me, do you think they should get the injection? My answer is already going to be yes. Why? This is something that has shown that can protect the body from this disease. Kids are exposed to a lot of people during the day, from teachers to other kids to somebody they walk into a room with that might have to stand there for a minute. They need that protection too. I take kids very seriously. And I'll tell you why. They're different than adults. Their metabolism is different. If you give them something, their bodies are so small, if you give them the wrong thing, they could die on you. Their circulatory system is small. So that's why we do all the weights before we give them anything, basically. With kids, you got to check their weight so that you don't give them too much for that weight group. So all of these things were taken into consideration by the bigwigs at the FDA, the bigwigs at the CDC. They looked at all these things, guys, and they decided that the benefit outweighs the deficit of giving kids from 5 to 11 the Pfizer vaccine. Okay, I trust it, guys. And I'm gonna say this is something I shared with somebody this week. We've had the Black Death, we've had the Spanish flu. Both of those maladies killed hundreds of thousands of people. What do you think defeated both of those processes or both of those diseases? It was science. Yes, it was the same science that's telling me now that this vaccine would be okay to give to someone 5 to 11-year-old. And let me put it to you this way, guys, I was kind of happy to hear that we needed a booster. A lot of people are worried about having that in their bodies long term. Well, the need for a booster means that it don't stay there. So your body flushes it out anyway and reaches its normal status again, or the antibody level decreases over a 6-month period for the Moderna and Pfizer. Now the J&J, it decreases over a 2-month period. So as I said in the last video though, at this point, if you want to switch vaccines, you can. Why? You don't have to give me a reason. You might have a reason that fits you, and I'm good with that. If you come in here, you're beyond 6 months for the Pfizer or Moderna, and you want to choose the other one, I'm fine with that. The FDA and CDC says there's no problem with it, so we'll do that. Or 2 months after getting the J&J. I give it to you right here, if you fall within that criteria. Now, it isn't these vaccines and whatnot, they do have some restrictions to them, but a lot of it will fit just about anybody. If you know how to look at how they worded things, they worded it so that just about everybody has access to these vaccines. It's not just people with comorbidities, it's people that work in jobs where they come into contact with a lot of people. Who does that? That's going to be your ambulance drivers, your workers in nursing homes, your workers in hospitals. Any of them can come in and get it. So guys, with that being said, I just want to do a quick video to let you know about the new services. And again, the monoclonal antibody therapy, we're doing it at Pain C right now, as well as the injections for 5 to 11-year-olds, guys. We're doing those right now too. So either call and make an appointment or walk in. We can get you done. If we can't get you done on a particular day, and I'll tell you why. We sometimes go out to nursing homes and take care of them. And it's a lot easier for us to gather up material, put our vaccines in a refrigerator, a portable one that we can plug into the car lighter and keep it cold. We can go out to the facility and then we plug that portable fridge in at the clinic, and we can be there all day giving the shots. Because in general, we draw and give within, I think, 5 minutes. so it's not a problem. But if we're out doing one of those, you'll get the close sign outside the building, and proposed time that we'll be back in. So keep that in mind. Call us. If it sends you the messaging, leave a message. I'll call you back, and we'll coordinate on getting you and your family taken care of. That's what we're here for, guys. I've taken my clinic to a focus on public health, so this is what we do, and we're getting very, very good at it. So with that being said, guys, be careful, be safe, and be well. See you next time, guys. Out.